Assalamu alaikum. Good evening to one and all. Today in this video we'll be discussing about esophageal cancer, or we can say carcinoma of esophagus. So before I start this video, I have a small request. Please watch this video till the end so that you can get all the points clearly understood. Okay. So if we will talk about the esophagus, we can say that esophagus is a long muscular tube about 25 centimeters in size in adults, and it would be extending from the root of neck and will be ending up to the cardiac sphincter. Okay, that is just the junction between esophagus and the stomach. Okay, so and we can also say that if we will talk about the anatomical location of the esophagus, we can say that it starts from the cervical vertebra 6, that is C6, and will be ending up to the and will be terminating up to the thoracic vertebra 11. Okay, so it will be having mainly three parts: cervical part, thoracic part, and abdominal part. Okay, so now let's talk about the this esophageal cancer. Okay, so what is esophageal cancer? Esophageal cancer is the malignancy of the esophagus, that is malignant tumor. What is malignant tumor? Malignant tumor is also known as cancer. The cancer or the tumor which can spread from one place, one area to the another area. Okay, then we can say we can have the metastasis. Okay, so next one would be like we can also say that when there is the abnormal and uncontrollable growth of the cells, understanding that will be arising either from the squamous cells, or we can say the glandular cells, that is secretory mucus secreting cells. So they would be developing abnormally and uncontrollably, or we can say rapid proliferation of these cells that will lead to the esophageal cancer. Now let's talk about the relevance or incidence of this esophageal cancer. Okay, so if we will talk about this esophageal cancer, it is the fourth main leading cause related to the death. अंडरस्टैंडिंग यानी ये दुनिया के अंदर ये चौथा कॉज है जिसकी वजह से फर्टिलिटी यानी लोग मर जाते हैं. ठीक है. एंड इफ वी टॉक अबाउट द इंसिडेंस of this case or relevance of this esophageal cases in the India, we can say that annually 47,000 of the esophageal cases are reported, and among out of 47,000, 42 cases of 42,000 esophageal cancer patients they would die. Understanding? So this is about the relevance of the incidence of the esophageal cancer. Now let's talk about the forms or the types of the esophageal cancer. So it depends from where or from which cell the this cancer has developed, yeah, arised. So there are many two types. First one would be squamous cell carcinoma, and second one would be adenocarcinoma. Squamous cell carcinoma means when the cancer cells are arising, or when the cancer or tumor it arises from the squamous cells, thin and flat cells which are located inside the epithelial tissue. So that we can say as squamous cell carcinoma, and squamous cell carcinoma contributes about 70% of total esophageal cancer. Okay, and next one is about the adenocarcinoma. What is adeno? Adeno means gland, and carcinoma means cancer. So means that the glandular tissue will be present in the esophageal lining. Understanding? So those cells which are responsible for the mucus secretion, those who are going to produce the mucus, so these cells will be affected. So that is known as glandular, or we can say adenocarcinoma. Okay, so this is about the types of forms of esophageal cancer. Now next one is about the etiology and risk factors. Then we can say causes and risk factors of the esophageal cancer. The first one would be gastroesophageal reflux disease. So what happens in gastroesophageal reflux disease? There would be some problems associated with the cardiac, associated with the lower esophageal sphincter. Understanding? When the lower esophageal sphincter is unable, and it always remains relaxed. Okay, in the relaxed phase, and the stomach contents would go, okay, and would be uprooted, and that would be uprooted into the esophagus, and the acid it may also grow, it may also into the lower esophagus, and will be destroying the tissues and cells of the esophagus. And second one would be any past history of cancer. अगर कोई past history है that might have spread to the esophagus and developing the esophageal cancer. Okay, and next one would be inheritance, and we can say genetic mutation. For example, when the gene, that is P53 gene, which is also known as tumor protein, is suppressed, is affected, or there is the abnormal formation of this gene. So because this gene is mainly responsible for the protection of your body from growing the abnormal, or because it's cancer cells. And next one would be, for example, we can say caustic injury. These are the risk factors. Okay, so we can say caustic injury means if a person accidentally have ingested the acid, or we can say alkaline or bases. Okay, so next one would be if you are consuming the alcohol, smoking, tobacco chewing, understanding spicy foods, hot liquids. Okay, so these factors they would contribute in order to contribute to the development of esophageal cancer. Okay, so this was all about the etiology. Okay, now let's talk about the TNM staging. How we are going to classify this tumor? So it would be classified on the basis of three categories. That is, first one would be tumor, next one is the lymph node involvement, and third one will be distant metastasis. If we will talk about the tumor, there are mainly four stages: T1, T2, T3, and T4. In T1, the tumor invades the tumor, or is a carcinoma or the tumor. It will be invading to the mucosa propria. Okay, that is the first line, first layer of the mucosa. This one mucosa lining, and then it would go deep into the this one we can say mucosa, then submucosa. Understanding? So this is about the T1. In the T1, the tumor will be invading to the mucosa propria, then we can say mucosa, then submucosa. Okay, and then also subserosa, yes, serosa, and serous layer. Okay. Next one will be T2. What is T2? T2 means when the cancer will be spreading. Understanding? The cancer will be spreading to the muscularis propria. अंडरस्टैंडिंग सो द कैंसर विल बी स्प्रेड टू द मस्कुलरिस प्रोपेरिया जो मसल होता है ना उसका जो पहला लेयर होता है उसको हम बोलते हैं मस्कुलरिस प्रोपेरिया देन वी कैन से then it will be going deep into the muscle layers. Okay, followed. Okay, the next one is T3. What is T3? T3 means when the tumor invades to the adventitia, tunica adventitia. What is tunica adventitia? Tunica adventitia is the outermost layer of the blood vessel. There are mainly three layers in the blood vessel. The first one would outermost is known as tunica adventitia, middle one is known as tunica media, and another one is known as tinea intima. Okay, so this tumor will be invading to the tunica adventitia, that's outermost layer of the blood vessel. Okay, now next one is the T4. T4 means when the tumor has spread to adjacent tissues like pleura, pericardium, mediastinum. Understanding? So, and we can also say the chest cavity. Understanding? So we can also say some part of the tissues. Okay, that will be surrounding this esophagus. Okay, so they will be involved. Okay, so this is about the tumor T4. So T1, T2, T3, and T4. Now next one is the lymph node involvement. Under the lymph node involvement, there will be the first one will be N0. Okay, I will just N0 and NX. So that time in that we will say that the primary tumor cannot be assessed, or we can say regional lymph nodes are not being evidenced or not being involved. Okay, and next one would be the N1. What would be N1? N1 means when the tumor has been spread to the 1 to 3 lymph nodes. Understanding? That is tumor, that is N1. What is N2? N2 means when the tumor has spread from 3 to 6 lymph nodes. And then N3. N3 means when the tumor has spread more than 6 lymph nodes. Understanding? So that is known as N3. Now the last one is about the distant metastasis. What is distant metastasis? It is the metastasis or spread of tumors to the adjacent organs or you can say structures, okay, that are located nearby to the esophagus. Okay, so it would be, we can say that in the first one would be M0 and second one would be M1. M0 means there is no regional metastasis, there is no distant metastasis, and M1 is there is metastasis. The tumor may spread to the esophagus, this one we can say windpipe, that is trachea. The tumor may spread to the liver. The tumor may go to the other areas which are near to the esophagus. Understanding? It would be also going to the lungs. Understanding? So when the lungs are also involved, so that time we can say distant metastasis. So this was all about the TNM staging classification of the esophageal cancer. Okay, so next one is, let's talk about the clinical manifestations or clinical features. The first one would be substernal pain. Okay, we can say the overall chest pain would be there. There would be hematemesis, that is the blood in vomits would be there. Understanding? And there will also be the regurgitation. There will be the dysphagia. There will be the odinophagia. There will be the bleeding will be coming from that area. Understand? Because the blood vessels are also affected. Okay, and we can also say there is the nausea, vomiting, and then we can say also there is the unexplained weight loss because the person is unable to consume the food properly. There would be the dysphagia. Okay, and we can also say there is the pain, okay, while swallowing. Okay, and there will be also the extreme tiredness. There will be the tiredness. Okay, so tiredness also will be there. So these would be the clinical manifestations which are related to the esophageal cancer. Okay, now next one is about how to diagnose, how we can diagnose as a nurse. So first of all, we would like to take the history, because I have already told you, if it is genetic, then if any family member, okay, the blood relatives, blood relation in your family, okay, if anybody was having your father, your grandfather, grandmother, they were having the this one cancer, okay, maybe it might have spread passed through the genes, okay. Yeah, we can say in the mother's womb a baby has got this cancer, okay. So yeah, baby has got the tumor, that gene which was affected, and the baby will be developing, and the person will be developing the cancer in his life, okay. And next one would be you are going to, why you are going to do the history collection in order to reveal the cause, understanding. And you can also ask a lot of questions. And also in the and next one would be like physical examination, okay. So in the physical examination you are going to reveal the symptoms, okay, by doing the methods of physical examination, understanding abduction, yeah, sorry, inspection, then palpation, percussion, and auscultation. Through that also you can reveal the symptoms of this esophageal cancer. Then you can go for some tests. We can say, like for example, you can go for the radiological tests, like we can say biopsy, okay. So you can go for the barium swallow, you can go for the manometer, that is examination of the esophageal motility, yeah, we can say movements, okay. You can go for the CT MRI, you can go for the positron emission tomography X-ray test, okay. In that it will be giving the clear picture on the screen so that you can visualize or identify the esophageal lining, okay. So this would be some tests. And you can also perform a CBC, that is complete blood count, understanding. This also you can also perform, understanding. So these would be some tests which you are performing, understanding. So in order to reveal the, we can say, symptoms, understanding. So you will be revealing the symptoms of the esophageal cancer. So there would be, these would be some diagnostic evaluation which you are doing in order to reveal the esophageal cancer, okay. Now let's talk about the management, how you can manage the disease condition. The first one would be if there is no obstruction, understanding. So because I already told you that if there is a Barrett's esophagus, so as soon as the cancer is developing in the esophagus, so it would, okay, it would, so depending on the stage of cancer, stage of tumor, okay, so it would obstruct the esophageal lumen, okay. So you won't be able to pass the food into the from through the esophagus, and will be going into the stomach, okay. So that time you can also go for, before the surgery or before the before going for the treatment, you should take this one, you should go for the angio-tube feeding. We can go for the angio-tube, nasogastric tube feeding, because the patient is unable to swallow properly, okay, in the, you can say, in the early stages, okay, yeah, early diagnosis. The next one would be, we are going to go for the enteric, that is gastrostomy, okay. Then you can say feeding a patient directly into the stomach, okay. Next one would be, we will be going for the TP, that is total parental nutrition, that is the administration of the this one nutritions, understanding, through the vein, that is intravenously, okay. So these would be some managing treatments, understand, non-pharmacological treatment. Next one would be medical treatment. Medical treatment may involve, we can say, chemotherapy. Under the chemotherapy you are going to give some anti-cancer drugs like 5-fluorouracil, you are going to give the cisplatin, methotrexate, and these drugs we are going to give in order to inhibit the cancer cells, yeah, in order to inhibit or control the spread of the cancer cells, yeah, you can say tumor cells, okay, yeah, tumor, okay. Now next one, let's talk about the next one is about the radiological, okay. So when you are going for the radiotherapy, okay, so radiotherapy may have a high magnified beam of X-ray is passed to the affected area in order to kill or in order to prevent your body from spreading the esophageal cancer. And next one would be, like, we are going to go for the photodynamic therapy. Okay, photodynamic therapy also you are going to use some, we can say, light rays will be passed, okay, into the affected area, so that this area will be identified and the cancer cells would be diminished, or they will be inhibited and they will be killed, okay. So this X-ray X-ray you are going to do, a radiotherapy you are going to give in order to this one spread the cancer, in order to prevent the spread of tumor. Now sometimes you can also go for the both chemoradiotherapy, that's known as palliative therapy, okay. So this will be some therapies or chemotherapy, that is for medical management you are going to give, understand, therapeutic management, so you are going to give in order to reduce the cancer cells. And if the cancer cells are not being reduced by giving the medication, yeah, by managing the symptoms, so then you can only go for the alternative, that is a surgical treatment. And in surgical treatment there are mainly two types of the surgeries which are performed. The first one is esophagectomy. What is esophagectomy? It is when the doctor or the surgeon is removing the portion or segment of the permanently affected esophagus. यानी esophagus का जो पोर्शन होगा, जो मेनली इफेक्ट होगा, जो डैमेज होगा परमानेंटली, उसको ही रिमूव करना है, दैट्स नोन एज एसोफेजेक्टोमी, ओके. एंड वी कैन आल्सो गो फॉर द, इफ देयर इज अ स्ट्रिक्चर, अगर इसोफेगस के अंदर नैरोइंग हुआ है ना स्ट्रक्चर, एंड डॉक्टर में आल्सो गो फॉर द स्टेंट प्लेसमेंट। अंडरस्टैंडिंग? स्टेंट प्लेसमेंट मतलब ये होता है कि जो डॉक्टर होता है वो इसोफेजियल ल्यूमन के अंदर एक स्टेंट प्लेस करेगा, ठीक है ना, एक मेटल स्टेंट प्लेस करेगा, और जिसके अंदर और along with the metal stent he is going to fix the balloon inside the stent, so that when the balloon is being inflated, the esophageal what we can say lumen will be dilated. Understanding? So this is also the method, so that, but it will be applied when the esophageal structure is there, yeah, narrowing the esophagus is there, and also it will be depending on the stage of cancer. If it is a fourth stage cancer, if the esophagus has been destroyed, damaged permanently, the area has been damaged, so the doctor is going to remove the portion of the esophagus, and he is going to surgically anastomize. Anastomy means surgically connecting the one part of the healthy part of the esophagus to the other part of the esophagus, so that the esophagus may work properly. Okay, so the improvement will be there. You can say modulated peristalsis improvement will be there. Okay, so this was all about the esophageal cancer. Okay, now last one is how we can prevent and control. You can prevent the from the post disease complications by giving the health assurance to the patient, by taking the medications on the proper time, by telling the patient to, advising them to quit smoking, alcohol, and do not consume the fast foods, do not consume the foods like hot foods, hot liquids, okay, which can irritate the esophageal lining. Okay, so these health assurance you will provide to the patient in order to protect or prevent the occurrence of the cancer, or we can say prevent from the complications that are related to this disease. Okay, so this was all about the esophageal cancer. I hope you have understood about esophageal cancer. So in this class I will be discussing about up to here only. So with this I am going to conclude. Okay, so it is Allah Hafiz. Assalamu alaikum.